A health alert now about new viruses detected in mosquito pools in Onondaga County. To help us understand more about them, Upstate Global Health Director Dr. Stephen Thomas. Always good to see you. Thank you, sir. How are you?
Good. Well, good to see you.
Good. So the Jamestown Canyon virus and the Flanders virus have now been found in these mosquito pools. That sounds pretty exotic to all of us and potentially dangerous. Right. What can you tell us about it? You know all about infectious diseases and certainly diseases that are carried by mosquitoes for sure. So what are these two things?
Sure. Yeah. So, the county does this great service of sampling the mosquitoes around the county and testing them for a bunch of different diseases, because that can be the first alert that there might be some potential risk to human health. So, yeah, they've identified so far this season West Nile, Jamestown Canyon virus, and then Flanders. And so Jamestown Canyon virus, I think in the United States last year, there were 26 cases total, one in New York, of people who actually got sick. But there's lots of instances where in places like New Hampshire and Maine and New York and Michigan and Wisconsin and Minnesota, that they can identify these viruses in mosquitoes. So, the risks to humans historically, it would seem to be extremely low. And when people do get infected and they get sick, it's usually a mild illness. They might have mild fever, headache, muscle aches, things of that nature. But they can, both Flanders as well as Jamestown Canyon, they can cause very serious brain infections and spinal cord infections, which is why they do surveillance for these types of viruses. And as you and I were talking about, everyone still remembers, back in the late 90s, the huge West Nile outbreak that just burned through the United States. So people are very sensitive when these viruses pop up in mosquitoes.
So what would you say our concern level should be? Should we really worry that much, or just at least know that it's out there potentially with these two new ones that we're talking about?
Yeah, I wouldn't be worried. I would just, number one, be informed, and number two, just be vigilant about protecting yourselves from mosquito. And I got to throw in there ticks, and we can talk about that if you want. But we're having a massive tick season and tick-borne disease season. So just be vigilant at protecting yourself. So that would be wearing DEET, trying to avoid places where there are high density ticks or mosquitoes, standing bodies of water, things like that. And wear long sleeves and long pants if you're going to be in those areas. Dusk and dawn is when some of these mosquito species like to feed. So just be smart.
Not so much specifically what these are, but just that mosquitoes are carrying these. So like you said, be vigilant. I want to talk to you before I let you go about dengue fever. It keeps spreading in the U.S. What areas are we seeing it most right now? And how could you contract it? Is it something, again, we should be worrying about?
Right. Yeah, so globally, dengue is on fire across the entire planet right now. And it's usually limited to tropical and subtropical diseases, but as the changing climate and changing ecology, the habitat for these mosquitoes is spreading, and so the people who are at risk is increasing. In the United States, we've had about 2,500 cases now, and most of them are locally acquired. But what you got to remember, Puerto Rico is part of that United States local transmission data, right? So most of those cases, about 1,700, are in Puerto Rico. We've had around 9 cases as of this morning down in Florida that were truly, they caught the infection in Florida. The rest of those cases are imported by travelers. So where they've had dozens and dozens of cases in Massachusetts. We've had lots of cases in New York, but these are people who have traveled, gotten the virus, and then brought it back.
Which is, I guess, maybe 30 seconds before I let you go here, why good advice if you're traveling to also remember, you may be on vacation, you may be visiting friends and family, but, protect yourself again still from mosquitoes, right?
Absolutely. And if you have traveled to any of these southern states, or you've traveled to Puerto Rico, the Caribbean, or even farther, and you come back and you have fever and headache and bone pain, you absolutely should contact your trusted clinician and have them evaluate you and let them know that you have traveled, so that they can call in some consultants if they need need extra help, because there are tests for this, and the outcome can be pretty severe. So you need to get diagnosed so you can be properly treated.
Dr. T, always a pleasure having you on. Thanks so much. We'll catch up with you really soon.
Thank you very much.